My name is Jessica Lee Branham, and I'm an OBGYN. I work at Physicians for Women, which is a federally qualified healthcare center based in the Eastern Kentucky region. I was opening a new practice that was a hospital-based practice, and the timing was perfect because at the same time I was opening a new practice, I had all these patients that hadn't had care for years. I had so many patients come in to see me, and they would say, I haven't had a pap smear in 10 years, 15 years. And I'm like, why haven't you had a pap smear in 15 years? And they would say, well, because I haven't had health care. So it wasn't until the Affordable Care Act, those patients for the first time were able to get gynecological care. And those patients were looking for a doctor, and I was the new doctor in town, so it was serendipitous. So I actually grew my practice from a lot of those patients. I was able to do their first pap smear. And unfortunately, the sad part of that story is there were so many patients I had seen that not only was I saying, hey, I'm your new OBGYN, and by the way, you have cervical cancer. And that's the sad part of that story, is that not only was I establishing a new practice, but I was also diagnosing a lot of new cervical dysplasias, cervical cancers, because these patients, again, had not sought care for so long because they didn't have insurance. I'm an osteopath by training, and one of the reasons why I went to osteopathic school as opposed to allopathic school, which is MD school, is because of this concept of preventative medicine. It's easier to prevent disease than it is to treat disease. So if we can catch cervical cancer before it's cancer, and we can actually cure it when it's just precancer cells, that's way easier than trying to treat someone who's already got cancer and needing radiation or chemotherapy. So again, when you're looking at both suffering of patients, of human suffering, you're looking at treatment. If you're looking at cost, it's way more cost effective to do preventative medicine than it is. And we know this. There's tons of data to back that up with.